why stress as such is a completely failed word in cancer. The beauty about stress is that when the problem is solved or problem is over, you feel normal. And this is how we expect stress to act. But in cancer patients, even if the entire problem, even if the surgery is over, the patient is completely cancer free and there is absolutely no treatment if it is still existing. This is what anxiety is. The fix is not simple. The fix is not by just wishing it out. The fix is complicated. But yes, it is very much treatable. So let me start today talking about the patient of mine. A 55-year-old lady suffering from breast cancer, and her surgery, her treatment was completely done and the recent scans were absolutely normal. She came to my consulting room looking very pale, confused, as something was there wrong with her. So I asked her exactly what was the problem. She told me, "Doctor, I haven't slept since the last 11 days. I had planned a vacation almost a year back, but at the last moment, I cancelled all the tickets in spite of all the bookings done just because I don't want to go away from the oncologist. I wanted him to be near me. Whenever the phone rings, my heart starts beating fast. I feel tightness in my chest. I know there's something wrong. I'm freaking out. Is there a flaw in me or is it the cancer coming back?" Well, there is absolutely no flaw in her. I've heard these conversations in a different way multiple times with different patients. She uses the word, "I have stress." Is this stress? No, this is not stress. This is another condition, another biology, and a completely different treatment. Probably nobody told her about this. And one wrong word, stress, how this created a problem for her condition is what we are going to discuss today. I am Dr. Chirag Jain with 20 years of clinical practice. I have seen endless patients go through various different types of cancers and the sufferings which they have gone through. Sometimes it is clinical, sometimes it's on their face. And this is exactly why we are going to talk about. We have started this first series of podcasts on the sixth vital sign, where we deep dive into the problem which is completely not visible. Of course, the doctor feels it, the patient feels it, the family member feels it, but it is not being completely visible. This is an attempt where we try to make this entire problem a clinical condition which is visible. One of the best things about being or suffering from cancer is that people come up and tell you that yes, if you are not feeling good, if you are feeling worried, then it is stress. Stress is a word which is being used very often just out of empathy, so that the person does not feel that he is actually having a bigger problem. But we are doing a complete disservice to the patient. And this is exactly where we are going to talk about in deep why stress as such is a completely failed word in cancer. Stress is one of the most simplest way of telling the patient that problem is there and it is going to resolve on its own. If you've got cancer, if you're going through chemotherapy or if you're going through a radiotherapy, you're obviously going to have stress. But once the stress is over, it's going to get over. So is stress a real thing? Of course, stress is very much real. You go for an examination and when you're giving your exam, you're bound to be stressed. But the moment your exam gets over and you're out of the examination hall, your stress disappears. If there is a business meeting you're going to go and it's very important for you and it's a very big deal you're doing, of course you're going to be stressed. And this is exactly where this will disappear away once that meeting is over. Either it could be in your favor, either it could not be in your favor. Stress will disappear when the cause is over. The beauty about stress is that when the problem is solved or problem is over, you feel normal. And this is how we expect stress to act. But in cancer patients, even if the entire problem, even if the surgery is over, the patient is completely cancer free and there is absolutely no treatment, if it is still existing, this is what anxiety is. Like in my first case, where the lady was still feeling the fear, this patient was still feeling that there is some problem going on. This is exactly what anxiety does. Anxiety will give you a lot of physical symptoms like trembling of your hands, tightness of chest, and you still feel it when the problem is completely solved. This differentiation is absolutely important, that cancer anxiety is not something which is going to disappear by just the problem getting over. This will survive in spite of the cancer being completely treated, or even if you are on a palliative therapy, a therapy where you know there is a stage 4 cancer, where even if you are not cancer free, still the fear, the anxiety is still surviving in your body. So this is one of the biggest differentiation, and let us try to dive deep into why cancer anxiety is such a big symptom, is a completely different treatment, completely different etiology as compared to cancer itself. Let me get you out of the realms of feelings, and let's talk more about the biological aspects. So what anxiety is? We know very well about the stress part, but what exactly anxiety is? Is anxiety an attitude? That's what most of the people feel. Okay, you have been getting anxious every day, so maybe it's a part of attitude. No. Let me explain to you why I am saying anxiety is not an attitude or something which a person has any control. So let me dive deep into the biology aspect, where we have two systems in our body playing, and it is called the nervous system. One is the sympathetic nervous system. The sympathetic nervous system works like an accelerator. So when you press on the accelerator, your heartbeat starts increasing, your chest tightens, you start sweating. And this is exactly what happens when the accelerator is on, whenever you are anxious. The second system is where we talk about the parasympathetic nervous system. It's like the brake. So when you press the brake, the car slows down, your heart rate comes down, and slowly your sweating comes down and you start improving. These are the two things which work tandemly in the body, and we together call them as the autonomic nervous system. This is how the entire mechanism works. So let me speak to you about the autonomic nervous system. So when you are in a state of stress, when your anxiety has gone, a temporary phenomena has taken place. Maybe it could be an examination hall, or it could be a situation which has ended. So when there is a problem, when there is a lot of stress happening, that is when the accelerator presses down. And when the problem or the situation changes, the accelerator comes off or the brake starts in, and that's where the parasympathetic comes in. And now this is an autonomic process. It goes off on its own. There is no control. And that's why it's a temporary phenomena. This is how stress is explained. But then what happens in an anxiety? In an anxiety, the brake is worn off. The patient stays only in the continuous stress of an accelerator where the heart keeps pumping. The mind starts scanning for those situations where the problem is happening. For example, in the lady who spoke to us, she said, "Is there something wrong with me?" Because it should have gone off. The cancer scans have come normal. Everything has worked in the right way. She's cancer free. But the brake has not applied. She's still in that accelerator phase. This is how anxiety functions. And this is how debilitating a cancer patient is. This is one of the most simplest way to explain the difference between a cancer and anxiety, and how these symptoms keep on persisting. When the accelerator is on, your sleep is disturbed. You are unable to sleep. You start panicking on small episodes. The fear, which was normally in control, suddenly you start saying, okay, I do not want to go for a planned vacation and I just want to cancel the entire trip. This is how anxiety takes over. So when we talk about the autonomic nervous system, where the accelerator coming in and the brake coming in, and this alternate mechanism, this is very much measurable, and this is measurable when the two beats of a heart comes in. So every beat doesn't say the same. The heart doesn't beat in the same way because it is completely influenced by this system, the autonomic nervous system. This is exactly where the measurement can be taken, and this has been well documented in the history. In 2023, a review in biomedicine found that heart rate variation is one of the established ways to diagnose the autonomic nervous system. So, this is one of the measures which is there, which we are going to dive deep, and it forms the basis of this entire conversation about anxiety. The three different phases of cancer. Let me start with you the first. A 52-year-old man who was diagnosed with a cancer, a tooth which was there, which was bleeding. He went to the doctor and the doctor found out that this could be a cancer, and a biopsy and an MRI was taken. Now, this patient has not yet been diagnosed with cancer. It could be a probable cancer. It could be a simple benign disease. But he completely lost it. He was unable to sleep. The family just curdled him. The family tried to explain to him, whatever is the problem, we will all fight together. His eldest son, his daughter, all were around him. His wife, she comforted him, saying that do not worry, we will face it. If it's the financial, if it is anything, we will take care together. They even tried to tell him that it's a phase and we'll all do it together. And that is the beauty about the family, where all of us come together and try to protect the person who's suffering from cancer. But for him, this was not making any sense. Whenever they were advising him, he was like, I have no control on it. He was unable to sleep the entire night. He was so scared. What if the cancer comes in? What will be there? In spite of the reassurances, in spite of the family trying to cuddle him, and in spite of the family telling that this would be taken care of, he still could not stop his mind from running around. The accelerator had been on and there was no break. The results came out. He was diagnosed with cancer and it was a treatable cancer. But still, he was in that accelerator phase. And this is exactly the problem where we call this an anxiety. An experience for the patient which is hard to get over so easily. Let me talk to you about a second patient. She's a 47-year-old lady who had a breast cancer, stage 1, and it was operated. She went through her chemo radio and she was absolutely cancer free. In cancer, every month or every 6 months, you need to do those scans. And whenever the scan would take place, she would be a complete different person. Her hands would tremble. She would start making mistakes. She would start getting worried. She would start sweating. And this would happen every time the scan would take place. This was a repetitive phenomena. And we call this the scan anxiety. This is a phenomena which many patients go through. The accelerator takes on and it happens every time when the scan takes place. What if the cancer comes back? The same symptoms, the fear, the remembrance of the chemotherapy, the symptoms which she had or the smell of the hospital all come back to her. This creates this similar symptoms where you call the tightness of the chest, the fear, all this becomes very real with the accelerator still being on. There has been no confirmation whether the cancer has come back. The patient knows very well this might not come back. There is no lump, nothing. But every time the scan takes place, this fear comes back. Let me talk to you about the third patient who's a 51-year-old man who is completely cancer free. He has gone through the entire treatment, and every year he has to go through a number of tests to know whether the cancer has come back or not. This every time when the patient is going for these scans, every time the patient feels that the relapse is going to happen, every funeral, every news that comes, every talk about cancer, this is going to be repeated. He feels the fear. He goes through this entire torment of the anxiety coming in. The acceleration has taken place. There is no relapse. Maybe the mind races and starts thinking about the possibilities which are not real. And this is exactly what the acceleration does. It just simply doesn't go off. It just keeps coming back whenever the thought that a relapse can take place. These are three different situations where we talk about three different patients, three different stages of cancer, and none of them have gone away like stress. They were not just surgery or a chemo or a radio and the treatment is done, and when they are off, the exhalation has gone away and the brake have applied. No, the brakes have not applied. And this is what anxiety does. There is no looking back. Someone quite reasonable, someone who has been seeing a lot of patients, can very simply tell me, why do you want to just play with the words stress or anxiety? What would be the difference? I can call anxiety as stress and stress as anxiety. Would that change anything? Well, I absolutely do not agree, because the moment we interchange the word, the entire meaning changes. And this is where I'm going to dive deep into and find out exactly why this wordplay has such a big role in the entire process. When we label somebody as stress, we mean to say it is a non-serious. Everyone gets it. We all suffer from it. And when the problem is over, it will get over. Why do you need to do anything about it? It's a normal phase. It's a normal symptom. And what is something so big about it? So stress is always underplayed. There is no treatment required. Treatments are very simple. People do it all the time. And it is a non-serious business. And the moment you label it as anxiety, it becomes a clinical condition. The next question which follows is that, how much of anxiety do you have? What are the problems you are facing? What is the solution I can give you? Is it solving? Should I refer it to someone? Since it is causing a problem, should this be treated in a very organized or a systematic way rather than just telling you to take a vacation? So these are the two big differentiation when we talk about stress and anxiety or interchange them. Like I said, if the acceleration had already taken place, then definitely it needs to stop. And if it doesn't stop, it becomes a clinical condition. The patient is suffering. So a study of 84 patients was conducted, and they found 1 in every 4 patients was suffering from cancer anxiety. And in the second year, they found that 30% females were suffering more from distress. Now this is exactly the problem what we are talking about. It is very much real. It is not something which you can just wish out, and which the patients or the doctor or their family member can simply wish it out, get that out of empathy, saying that this should get over. This is exactly the problem what we do when we interchange the word and make it a non-serious business of stress. Now, the most frustrating thing about this entire process is to how to make it visible. There is something called as a distress thermometer, which is very much there. This thermometer is always existing. But do we use it often? And it's a very simple question. How distressed you are feeling? If the patient says, I'm very distressed, it's 8, 9, it simplifies and it tells that the patient is actually suffering. It is debilitating. He is finding it difficult to do the day to day activity. He's not able to sleep. He's not able to focus on his work. He's not able to enjoy the life. Now, these are some of the very simple distress thermometer questions where they can ask the patient. Once they realize that the patient is in the anxious state, patient is suffering from anxiety, they can dive deep, give them the right referrals. There's another mechanism which we call it the heart rate variation, which is again an underutilized. Like I said before, every beat is different from the previous one. And here we can measure the autonomic nervous system. We'll dive deep later where we can use this tool to actually come to know exactly what the patient is going through and can find better solutions so that they can be anxiety free for the rest of their life. The fix is not simple. The fix is not by just wishing it out. The fix is complicated. But yes, it is very much treatable. And that is what I'm going to come into. Just labeling somebody as anxiety does not mean that there is no treatment. It is very much treatable. The patient wants someone to ask you, and that's where the distress thermometer comes into play, where you actually label the distress the patient is suffering. Once you know that, the next step is how you can treat it. So the entire conversation which I have had is talking about the problem. The problem is bigger. The problem needs to be identified. The problem is completely underdiagnosed. People have not labeled it. But then, is there a treatment? Is there a solution? And the good news is that there is treatment. There are multiple researches which I've done where there are multiple solutions which are mostly non-pharmacological and partly assisted by pharmacology. So let me talk to you about the first treatment, which is the cognitive-based therapy. In 2019, a paper where they have clearly described cognitive-based therapy, which is one of the first lines for treatment for anxiety and distress in cancer patients. This is measurable, this is trackable, and this is completely where the treatments can be solved. The second is the mindfulness-based interventions, where we talk about the results, the pre-cancer anxiety. All these can take place. A 2019 meta study clearly says that yes, the solution is there and cancer anxiety can be very much controlled with regular practice of mindfulness. Third, use of pharmacological drugs along with CBT have also been prescribed where they have found very definite results for patients who are suffering from cancer anxiety. So there are multiple solutions which are existing, which are backed by a lot of research and people have responded. A simple solution a simple labeling of the problem and the seriousness can get us the right kind of treatment which should not hamper the entire cancer treatment as such. A patient should not withdraw from a chemotherapy just because he's suffering from cancer anxiety. A patient should not be suffering from depression or should not be cut off from the entire world just because he has not been labeled as cancer anxiety. Somebody told you stress. That does not mean that this is a problem which will just go away. So let me come back to the lady who came to me after finishing her scan and she had cancelled her trip. If somebody would have told her that yes, she was suffering from cancer anxiety rather than just simply stress, she would have found out more. The doctor would have dug deep. Somebody would have asked her this simple question where what was her distress level, and using the distress thermometer they would have known how distressed she is. A treatment would have found out, a referral would have been made, this would have been taken up more seriously, and she would have realized that it was not a flaw in her. She was not weird. It was a real problem, a real biological process which many suffered through and they have got treated completely. This is the take home message which I would want to give and the main reason for creating this entire series of the sixth vital sign to get this problem upfront, to get more conversations around this, and many other therapies which are existing which can solve a completely treatable problem, a cancer anxiety. I am Dr. Chirag Jain, pursuing this entire podcast so that people are aware of the problem, doctors ask the right questions, they label it, not just wishing it out as stress, a clear discrimination between stress and anxiety, so that the patient complete their cancer therapies, complete their entire treatment, and have a good quality of life. Next time you're sitting in a waiting room, waiting for your scans to come, or you've just been having a probable diagnosis, or after the entire treatment, you go to the doctor and tell them, yes, I am suffering from cancer anxiety. It is not weird. As we dive deeper into the other problems and other solutions, and we speak to a lot of doctors who have seen this similar cancer anxiety. Until then, adios.